What would happen if you were exposed to plutonium? Picture this: a small, unassuming piece of metal, but one that holds incredible and incredibly dangerous power. What if you touched it? Or worse, what if some of it got inside your body? Stick around, because we're about to dive into the world of one of the most hazardous substances known to humanity. First things first, let's clear up a common misconception. If you simply held a piece of pure plutonium-239, would you instantly drop? Probably not. The primary danger from plutonium comes from alpha particles. These particles are like tiny, energetic cannonballs, but they have a very short range. In fact, your skin's outer layer of dead cells is usually enough to stop them. So, a quick touch might not be immediately catastrophic, but you definitely wouldn't want to make a habit of it, and you'd need to wash your hands extremely thoroughly afterward. The real life-threatening danger begins when plutonium gets inside your body. This can happen through inhalation, ingestion, or through an open wound. Once inside, those alpha particles are no longer blocked by your skin. Instead, they are set loose to wreak havoc on your living tissues. Imagine these particles tearing through your cells like microscopic bullets. They bombard your DNA, shattering its delicate structure and causing mutations. This cellular-level damage is what we call radiation poisoning. If you inhale plutonium dust, the particles can get lodged in your lungs. From there, they continuously irradiate the surrounding lung tissue, dramatically increasing your risk of lung cancer over time. Some of the plutonium can also be absorbed into your bloodstream. Once in your blood, it travels throughout your body, eventually accumulating in your bones and liver. Once plutonium settles in your bones, it's like having a tiny, radioactive factory set up right next to your bone marrow. It irradiates the marrow, which is responsible for producing your blood cells. This can lead to leukemia and other bone cancers. Similarly, in the liver, it can cause liver cancer and other severe damage. The scary part is that your body has a very hard time getting rid of it. Plutonium has a biological half-life of about 20 years in the bones and 50 years in the liver, meaning it will sit there emitting radiation for decades. This long-term internal exposure is what makes plutonium so incredibly toxic. It's a silent, persistent poison that damages your body from the inside out over many years. It's often called the most toxic metal on Earth, not because it causes an instant reaction, but because of its relentless, long-term destructive power. It's a stark reminder of the immense forces we've unlocked from the atom. So, while you might survive touching it for a moment, getting plutonium inside you is a one-way ticket to a lifetime of health problems. Thanks for watching our deep dive into this fascinating and fearsome element. If you enjoyed this journey into nuclear science, make sure to hit that like button and subscribe for more mind-blowing content. Stay curious and stay safe.